Health and Education Committee. Before we get started, I need a motion to conduct this meeting electronically. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of coronavirus.
Madam Chairman, I so move.
Mr. Gurley, thank you.
Second.
Mr. Blair, very good. You can call the roll.
Mr. Cook, Mr. Blair,
Yes.
Mr. Key,
Yes.
Mr. Gammon,
Yes.
Mr. Gorley,
Yes.
Mr. Phillips, Chairman Allen.
Yes, thank you. All right, our first order of business is to approve the minutes from the previous meeting.
Takes me a moment to get up, Madam Chairman. I apologize. Madam Chairman, I have read through the minutes of the past meeting, find them in order, and without objection, I move for their approval.
Very good. Thank you, Commissioner Blair. Do we have a second? Very good. Commissioner Phillips?
Commissioner Key,
Yes.
Mr. Gammon,
Yes.
Commissioner Gorley,
Yes.
Mr. Phillips,
Yes.
Mr. Blair,
Yes.
Chairman Allen.
Yes, very good. All right, our next order of business is with the Health Department report, and I would like to gleefully welcome our new official director, LaShann Dixon. Welcome.
Thank you, and good afternoon or good evening, may I say. And I'm very excited to now officially say that I am serving as the Public Health County Director for the Rutherford County Health Department. So Mayor Ketron, Madam Chairman, and Commissioners of the committee, once again, good evening. Tonight, I will be presenting the Health Department report of community health outreach, providing the COVID-19 updates, and seeking approval for our 2021-2022 budget. So at this time, will you please take a look at the February 2021 report of community health outreach. Our three columns labeled Protect, Promote, and Improve once again have not changed much as our staff continues to work hard to ensure that we test, vaccinate, and provide education and guidance to help mitigate the spread of COVID-19 in our county. However, one thing that I would like to briefly discuss that was done last month is our community baby shower, which was held on Saturday, February the 6th. As the visionary behind the community baby shower, which was born in the dining room at Patterson Park Community Center over 7 years ago, I'm excited to share with you all this evening that this year we were able to shower over 200 families in our community via our drive-through community baby shower in less than 3 hours. Our staff at the Rutherford County Health Department, along with our certified partners, United Way of Rutherford and Cannon County, worked hard to plan this year's community baby shower. And while the community baby shower did look a little different this year, one thing that remained the same was the love, resources, and essential baby supplies that we were able to shower these expecting families with. Along with the diaper bags full of essential baby items, educational resources were also provided, and participants were able to go online and answer questions regarding those resources and win door prizes from our amazing community partners. And while COVID-19 has changed the way in which we implement our community baby shower, the Rutherford County Health Department was very prepared to host this drive-through event as we've been practicing this manner for about a year during the pandemic. Our goal was to truly celebrate these families and provide them with the most amazing, fun, and memorable experience that they could ever have during a drive-through baby shower. So as we look towards 2022, the Rutherford County Health Department is looking to continue, as we previously have done, hosting this event with vendors, educational classes, demonstrations, and more. Finally, I do want to take this time and opportunity to thank Janelle Jenkins with Patterson Park Community Center, Casey Warren with the United Way of Rutherford and Cannon Counties for the continued support of the community baby shower, and many of you all in the room. Next, I'll be moving forward with our COVID-19 updates. So testing. We are currently testing Monday through Friday, 8:30 a.m. to 10:30 a.m. at our State Farm site located at 2500 Moore Boulevard here in Murfreesboro, Tennessee. One important update to mention is as of March the 15th, we've moved to appointment only of the oral pharyngeal swabs of PCR testing on Tuesdays and Thursdays from 8:30 a.m. to 10:30 a.m. So if you or someone that you know would like to schedule an appointment for PCR testing, they can call the County COVID-19 call center at 615-898-7997. Again, the call center number is 615-898-7997. As a reminder, both the oral pharyngeal PCR tests and the COVID-19 self-tests are free. However, the self-tests are not approved for children under the age of 18. And so for children and adults unable to register online, they can also still receive this standard drive-through oral pharyngeal COVID-19 test on Tuesdays and Thursdays by calling to schedule an appointment. Along with testing, we continue to work all investigations that goes along with positive cases and their contacts 7 days a week. Once again, we could not do this without our amazing community partners, and I want to take this opportunity to thank Chris Clark, our law enforcement, EMS, and our National Guard partners for continuing to help us with vaccination and testing efforts. A lot has changed since I last met with you all a month ago, and so please bear with me as I go through all these changes, as I want you to be informed, and also those who are watching and they're present today. So yesterday, Governor Bill Lee announced that all Tennessee adults will be eligible for the COVID-19 vaccination no later than April the 5th. So Tennesseans aged 55 years of older and those in phase 2 of the state's COVID-19 plan are now eligible for COVID-19 vaccinations as of this past Friday. By April the 5th, all Tennesseans ages 16 and over will become eligible for COVID-19 vaccinations. Eligibility for those in phase 3 of the state's COVID-19 vaccination plan will run alongside with the age-based eligibility. Phase 3 includes residents and staff members of congregate living facilities, including college dormitories, group homes, and shelters, and those in the correction systems. Phase 3 also includes grocery store workers who were not eligible for vaccination based on previous age or risk-based categories. To help ensure that vaccines are available to these populations, direct allocations of vaccines have been made available to these particular facilities. Tennessee also continues to increase supplies of COVID-19 vaccine, which allows for the state and our county to rapidly accelerate through this eligibility to receive the vaccination. As we move forward with receiving vaccination, we will be expanding our COVID-19 vaccination eligibility. And as we look through those vital operations that we'll be doing, these groups will also include child welfare, adult protective services, commercial food manufacturing workers, commercial agriculture workers, and then public transit drivers and maintenance personnel, and then all others, transportation and public infrastructure and telecommunications and utility industries. So the vaccine allocation phases have been revised, and you can find that on the Tennessee Departments of Health website as well as our Rutherford County Health Department's website. So booking for appointments, and I know this has been very important as we continue to move through our phases. And so to find vaccination providers in the area, individuals can visit vaccinefinder.org. Once again, that's vaccinefinder.org. So Tennessee County Health Departments across the state currently have available appointments for COVID-19 vaccinations. So you can book an appointment with the county health departments by going to vaccinefinder.org. Additionally, of course, we have our amazing call center that they can call, as well as going to covidrc.com to schedule an appointment. I also want to continue to remind individuals that as we move through our vaccination phases, it's going to be important that we continue with our 3 W's of wearing a mask, watching your distance, and washing your hands. And getting tested when exposed or sick are also very critical in controlling the pandemic. As we look at the vaccination effectiveness and talking about the 3 vaccines that we have, we've learned that from clinical trials involving tens of thousands of people who took the vaccine, that the Pfizer vaccine is about 95% effective at preventing the COVID illness. Moderna is about 94.5% effective, and the Johnson & Johnson vaccine is 85% effective, and we do have all 3 here in our county. Currently in our county, within a 25-mile radius of where you all are there in the health department, we have about 50 providers who are actually offering vaccine in our county, which is amazing. And as the state continues to onboard additional locations, they will update this on vaccinefinder.org and additionally on our website. As we move forward, we continue to work alongside with Middle Tennessee State University, Murfreesboro Medical Clinic, Stonecrest, and both school systems to help administer more vaccine in our community. And I'm extremely proud of the work that our community partners continue to do as we go through this pandemic. Starting on April the 19th, on Mondays, we will have evening hours until 6:30 for vaccinations. And on Fridays, we'll have earlier morning appointments to help expand this access to our residents here in our county. Additionally, we are partnering with Ascension St. Thomas and the Mobile Health Unit to ensure that everyone can have access to the COVID-19 vaccine, removing any barriers that may exist for our poor and vulnerable populations that we serve. We hope by doing this, we can maximize our outreach efforts as the mobile health unit is able to assist in hosting many vaccination events in our community. Understanding that there's also some hesitancy when it comes to the COVID-19 vaccine, we have started discussions on how we can educate and provide resources to minorities in our community. I want to thank each and every one of you all and those who are watching as well for their understanding and patience as we move quickly as possible to provide vaccines to our residents. As we talk about our local call center and messaging, I just want to remind everyone that the purpose of our call center is to assist our county residents with signing up for the state's new VRAS scheduling system as well as our county's system. Following up with persons on the wait list, which we currently do not have a wait list right now, and then also scheduling second dose appointments. Our call center, once again, can be reached at 615-898-7997, Monday through Friday from 8:30 to 4. I also, once again, want to remind everyone that we do have our covidrc.com sign up now, and persons who want to receive a vaccine can go to that website, and hopefully this will cut down on some of the confusion in the process. As always, thank you all for all that you do and for getting this messaging out. As far as our numbers of vaccines reported, because I know that may be something that's on your mind. So as of today, and our numbers, of course, are still coming in because we just finished our numbers for today. We have 77,337 that have reported vaccines, which is 15.96% of our county population with at least one dose of the vaccine. So I will stop right there to see if there's any questions before we're moving forward with our budget and discussing that.
Okay, very good. Any questions for LaShannon? Incredibly thorough report, which I appreciate. We function on high levels of information, but I do want to congratulate you. We just continue to get such great feedback about how you all are handling things over at the State Farm Center. But I'm also incredibly impressed that you even attempted to hold the community baby shower. I know how many families that blesses, and it would have been a very convenient time for you to say, you know what, we can't do that this year. So congratulations to you and your team. You've just done a fantastic job. We appreciate you so much. There's no questions for LaShannon. I'll entertain a motion to accept the report.
So moved, Madam Chairman.
Second.
We'll call the roll on that, and then we'll look at your budget.
Commissioner Gammon,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Phillips,
Yes.
Commissioner Gorley,
Yes.
Chairman Allen.
Yes, thank you.
All right. Well, thank you all once again for all that you do and for your continued support of the Rutherford County Health Department. And as we move forward to speak about our fiscal year 2021-2022 budget, if you will take a look at that, and we're going to start with 55110. So we are requesting two increases in two line items, and then also reducing, three increases, and then also reducing one. And so the first one that I'd like for you all to take a look at is 55110-140, which is salary supplements. This is to provide additional compensation for the public health director and the department increase of $5,000. The next line item is 189, which is other salaries and wages. So we are requesting one additional new position of our Wic Program coordinator, pay grade of 25. And so when we're thinking about our Wic Program, and just to give you a little background information on our Wic Program, our Wic Program is a huge federally mandated and funded program that provides assistance to women, infant, and children's, and infants and pregnant and postpartum women. It is a short-term resource that provides nutrition education, healthy food, and breastfeeding support. Although it is short-term, the influences have lifetime and huge effects. A famous song that I really love is called, some of the lyrics in it says, I believe the children are our future. Teach them well, and I'm going to change it, and also feed them well and let them lead the way. And so one of the results of the studies done by the USDA shows that for every dollar spent on our Wic program, our states or county results in longer pregnancies, fewer postpartum births, lower incidence of low birth rates for infants, and fewer infant deaths, and higher rates of childhood immunizations, which may be, of course, more beneficial. So the need for our Wic program coordinator here in our county is that, of course, during the pandemic, we have lots of individuals that have become pregnant, and so our WIC program has grown along with our population. It takes up about 60% of our total clinic visits here in Rutherford County. And now we have the following staff that we have across both sites, our Murfreesboro and Smyrna sites: 3 registered dietitians, 3 nutritionists, 2 RNs, 1 LPN, and 2 full-time breastfeeding counselors and 1 part-time breastfeeding counselors. So this is a total of about 12 employees in this program alone. So our existing nursing supervisor previously supervised these employees along with 29 other clinical staff. However, our WIC program and our clinic are very different and both require active supervision. And so the idea behind this is to ensure that we have opportunities for both our employees, but then also our staff to grow. So the duties for the supervisor would include supervising these 12 employees, which will be the lead person for our entire Rutherford County WIC program, and then also be the liaison between the local and state agencies along with our WIC. They would supervise our additional programs that are involved with WIC, such as our breastfeeding peer counseling, baby and me tobacco-free, and Talk With Me Baby. If you look at line item 307 with communications, we plan to reduce this by $22,600 thanks to the work of Cody York, Wilkie Buchanan, and Christy Knox for all the amazing assistance in helping us with our communications. I believe I've come before you all twice to ask for an increase in that line item due to the amount of calls that we are getting in. However, with their assistance, we will have a new phone system up that we'll be able to utilize, and which will help us decrease this line item by $22,600. And then finally, for 55110-399, we're looking at other contracted services. And this is going to increase due to our Stericycle and our biohazard waste disposal that we are having to do with our pods over at State Farm, additionally through doing more vaccine management as well.
All right, are there any questions for LaShannon? Yes.
One quick question. Asking for one additional position for your department. One position, one additional. Does all that money come locally, or some of it state money that can be paid for that?
So for this position, we're requesting for it to be a county position, so it will come all locally. We do have all of our WIC coordinators that we have currently that are helping and assisting with the WIC program are paid through our county budget, and then we have some of it is federally funded, but this particular position we are asking for it to be a county position.
Okay. Any type of grant that might be available to help us with that position that you know of?
No, sir, not that I'm aware of.
Very good. Thank you.
Thank you.
Any other questions for LaShannon? LaShannon, why don't you go ahead and look at the dental and the
Yes.
the others. We can do them all at once.
Okay, perfect. And so going to our general, and we will look at 55170. So we're not asking for any increases or decreases in these line items that we have for our drug and alcohol program with advertising and everything. So nothing on that one. And then 55190, which is our general fund as well, not asking for any additional increases or decreases there.
Edgar, did you have something?
Whenever you get through, I'll just make my recommendation.
Very good.
And so this concludes the budget request for 2021-2022 for our other health services fund general and alcohol drug program general and our local health programs, local health center general as well.
Very good. All right. Any questions on our budget?
Move forward to budget with a positive recommendation.
Thank you.
Second.
Very good. Thank you. Did you want to add before we went?
Sure. Thank you, Madam Chairman. Members, keep in mind the health benefits are still up in the air. We ask every department to plug in 10% So we should see that tweak down some as you're going through this. So we'll see a slight decrease there. The $5,000 we were able to negotiate. We do have permission. I have it in writing from the Commissioner of Health that we were able to supplement her salary because they had only offered her $5,000 less. Our legislative delegation, our two powerful members, Senator Reeves, who's on Senate Health, and Brian Terry, who is chairman of House Health, had a conversation with the commissioner and got things worked out for Ms. Dixon, and we're happy that things worked out. And so that's so she left our employment, and we have posted her replacement. That's underway as we speak. The names are into HR, and so she left our employment is on the state, but we will be supplementing the additional 5, Madam Chairman. And I approve this budget.
Very good, thank you. All right, will you call the roll for us?
Commissioner Gorley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Key,
Yes.
Commissioner Blair,
Yes.
Commissioner Gammon,
Yes.
Chairman Allen.
Yes, thank you. All right, LaShawn, we've got one more thing for you, is that right? On the current agreement, are we supposed to be looking at that, that's on our iPads?
Yes, ma'am. The current agreement, so this is our current agreement between the Tennessee Department of Health and Rutherford County. And so this agreement is what we sign annually. And so this agreement is for the first day of July 2020 between the Tennessee Department of Health, referred to, of course, as a state, and the Rutherford County. And so this agreement is collectively, and so it has the total appropriations that the Rutherford County Health Department will be supported by with the direct local funds, and then the appropriation for the county should be, of course, billed in accordance to item 3 below. And so the information that's provided there in front of you does have all the information that we are requesting to be accepted and approved tonight from you all with the agreements of both parties.
And then for any of you who are not familiar with this contract, this is an annual agreement. They always send it to us months in arrears, and so this is not uncommon for us to just now be seeing a July 1 effective date contract. Okay. All right, any questions?
Madam Chairman, move to approve.
Thank you, Commissioner Gurley.
Second.
Thank you, Commissioner Blair.
Commissioner Key,
Yes.
Commissioner Blair,
Yes.
Commissioner Gammon, Commissioner Gammon,
I think he's frozen.
Yes.
thank you. Commissioner Phillips,
Yes.
Chairman Allen.
Yes, thank you. Thank you, LaShawn. Keep up the good work, and absolutely let us know if there's anything more we can do to support you all, okay?
Once again, thank you all. I'm humbled and honored to continue serving in this capacity. And as the mayor said, that I haven't gone anywhere. I'm still here, and I'm still a Rutherford County resident, and I'm still working for the county. So thank you all for your continued support of the health department for all that you do.
Great, thank you so much. All right, next on the agenda is the community care report. Mayor, you have anything to share with us?
Sure. Thank you, Madam Chairman. Members of the committee, Mr. David Zach, the acting director out there, he's actively looking for his replacement because he is the CEO for United Church Home. So as soon as we find one, go through that interview process, we'll have somebody permanent. He is living there on the premises in our guest home that's on the premises. We did open up finally. We were able to get clearance to open back up for friends and family, so that's been long awaited, where our friends and family can actually touch our patients, touch them, kiss them, hug them, and cry. And I mean, it's been kind of sweet that they, since last March, that's a long time to be without touching somebody that you love, peck through piece of glass and be able to talk to them. So now we've opened up. We were just delayed because you had to reset. Every time you got a positive case, you had to reset and start all over again. So every time we'd advance forward, when we get to like day 23, we get a positive case and we'd have to reset. So it took us several months to get through that. Got word yesterday that Mr. Doug Bodery, who sits as finance chair on the board for community care, and of course, finance chair for the Department of Education. His wife's grandmother is a patient there, so they spend a lot of time out there seeing their grandmother. And he was so elated, he stepped up yesterday and let me know he was going to volunteer $300. And then Melissa Harrell, our court clerk, found out about it. She said she would match it, so we're up to $600. Mr. Bodery has engaged the Riverdale FFA to come out and plow and till up a community garden and plant it, and so the money's going to go to plant the seeds. And then we've got Mr. Cope at our community work center, who's going to go out and pick the weeds all summer and help harvest the bounty of cucumbers, tomatoes, and everything that comes in. So all the food will be kept there at the nursing home and the correctional work center, and whatever's left over. So that's kind of it.
Awesome. Is there any update on the construction?
Construction, we're still underway. There was some talk. They because of cost, if anybody's been in looking at what's happened in the construction industry, it's like doubled, especially anything that has petroleum based in it. A sheet of plywood is gone from like $24 to like $53. And anything petroleum based is even worse. So they kind of scaled back, but I think the board still wants the old wing. It has concrete block, and they wanted more than just paint on it, a new coat of paint. So they're currently going to do a sample of some type of knockdown, something epoxy or epoxy cement that can go on the wall, and then paint that to where it's not as cold and institutional looking. So they're testing that this week to see what will stick and stay on that. But they were limited based on fire code. They couldn't build a frame and put sheetrock up because they're old, narrow aisle in that nursing home, so they couldn't come out. They were limited on fire code. So what they're going to try to do is just put something that will stick to the concrete block and adhere to that. So we're progressing along.
That's awesome.
Good.
Very good.
Thank you.
Right.
Concludes the report.
I'll entertain a motion to accept the report.
So moved.
Blair?
Commissioner Gorley?
Yes.
Mr. Key?
Yes.
Commissioner Blair?
Yes.
Mr. Phillips?
Yes.
Mr. Gammon? Commissioner Gammon?
Yes.
Thank you. Chairman Allen?
Yes, thank you.
Yes.
All right, special projects, Ms. Jolly. Welcome. Oh, hang on, sorry. Go ahead. I had to turn on my mic.
The report this month is showing building fund program budgeted funds that are removed from the Rockville High School and the Rocky Fork Elementary School to 5 new projects. And on the report on page 4 and 5, I've got future new elementary project at $1,783,301, Smyrna Middle School Annex renovation at $275,000, Rockville Middle School addition at $329,250, Stewart Creek Middle addition at $329,250, and Rockville Elementary Annex at $475,000. And I've taken Rockville High and Rocky Fork Elementary off the report.
Good. That was something that we had discussed previously, taking those funds, routinely do that, we'll close it a project. Yes, Commissioner Gurley?
Yes, I have a question. When did we approve these additional items?
I know we discussed this, I want to say last month, and then we discussed it again. It came through commission as well, that it was a sort of more or less a housekeeping thing to close out one project.
So this is just design work here, right? Okay.
Yes. Any other questions? Nope. All right. Very good. Second.
Second.
Thank you. Commissioner Blair?
Mr. Key?
Yes.
Mr. Gammon?
Yes.
Mr. Cook? Yes. Commissioner Blair?
Yes.
Mr. Gorley?
Yes.
Mr. Phillips?
Yes.
Chairman Allen?
Yes, thank you. Thank you, Ms. Jolly. All right, now we've got the school board. See Mr.
Yes.
Sherlock there, welcome.
Yeah, welcome. Glad everybody is safe and in their building right now. What we have here is we have two items tonight, and one of them I'm going to do the 5-year building program, which we would specifically be looking at the 2021, 2022 requests, and then, of course, as we do every year, we go back and look at these things, and they may be modified for the coming years. But we'll start with the Rockville Elementary project. As you can see there, the cost for the elementary annex for the design is $475,000. The site work predicted to be somewhere around $750,000. Furniture and other equipment is I lost my train of thought here. Furniture and other equipment for that project is projected to be somewhere around $850,000, and in the construction at $13 million, with the projected final cost of $15,075,000. On the Rockville Elementary, the current enrollment at Rockville Elementary is 1,042 students. The original capacity is 870. We have 9 portables out there. Some are doubles and some are singles. Our percent of capacity there is 120%. Now, we will be moving some of our students out of Rockville Elementary during the rezoning, or we will be during the rezoning of Plainview Elementary. However, that's primarily just going to empty our portables. And we know with all the growth out in the Rockville community that's continued going to be an issue. And the next project is also out in Rockville, and it's Rockville Middle School. And when we look at this, we want to add 20 classrooms. The design is $445,000. The site work, $350,000, and FF&E is $350,000, with a construction at $9 million, with a total projected cost of $10,145,000. Rockville Middle currently has an enrollment of 1,294 kids. Its capacity is 1,040, and it currently has 9 portable classrooms. That's a percent of capacity at 124%. The next item that we're requesting is the renovation of the Smyrna Middle School Annex. Now, this annex was actually opened in the year 1977 and 78, and I remember that. And it was a career and technical education annex, but back then we called it vocational. And obviously, it didn't have many rooms, but it did have some of the shops and things of that nature. What we're requesting is to renovate that in order to build the capacity of Smyrna Middle, which is currently, the Smyrna Middle capacity is 937. But if we build out this renovation, if we renovate this, we can bring it up to 1280. Now, I say all that is because we want to do something at Blackman Middle. Currently at Blackman Middle, this year, the enrollment is 1,565 kids. But prior to this year, there was 1,610 kids. Now, when we looked at this, we determined, we saw a discrepancy in what we normally get in 6th grade. Now, that is a zone in which there are city, and we know that the city school system started back earlier than we did. So what we would like to do is, with this renovation of the Smyrna Middle Old Annex, is we would like to rezone approximately 250 to up to 300 students out of Blackman Middle and over to Smyrna Middle. The total cost for that renovation as we look at it across the board there, and we look at the various things, the design, $275,000, the site work, $50,000, the FF&E, $350,000, the construction, $5,500,000, with a total cost of $6,175,000. For these three additions and one renovation, the total cost for these three projects is $31,395,000.
A lot of information. I'm sure there's questions. Commissioner Gurley?
Yes, I just want to understand for sure that what we're talking about with Smyrna Middle, we're talking about what used to be the old shop building part and so on. It was when it was high school, and then it later on added on to, and so on.
Yes, sir.
That's what you're talking about into renovating into true classrooms. Am I correct?
That is correct. Yes, sir.
When it comes to the motion, as I read it right here, says to approve the 5-year building program and the requested projects for the 2021-22 school year. I personally have a problem with that motion.
Commissioner, if I can jump in real quick, I think I've changed that from, and I apologize because I looked at the same thing that you're looking at, and I did amend that, and I apologize that we did not get the corrected motion to you.
Yeah, I have a problem in approving a 5-year building program when we don't know where we'll be 5 years from now. We probably don't know where we'll be 2 years from now. So when I'll listen to your motion when you get to it.
Yes, sir. Absolutely. Let me go ahead and read that. Motion to approve the 2021-2022 project request that is part of our 5-year building program as requested.
And so the 5-year building program that we're looking at, we always know that that's very fluid. This is conceptual. We're not committing funds to anything beyond what he's asking for.
But if the way this was worded,
previously,
I agree. In fact, I'll make a motion to approve.
Very good. Thank you.
Second.
Good. Commissioner Blair?
I'll second that motion.
Okay.
Let me commend the administration for expanding our school systems instead of building entirely new school systems. I think that's what this commission, this committee, and this commissioner have been looking for a while. Good job. Thank you.
Thank you.
Call the roll, please.
Commissioner Cook? Yes. Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gorley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes. Thank you. All right. Mr. Spurlock?
All right, Mr. Lee.
Welcome.
Good evening, Commissioners. I failed to ask where we were meeting tonight, so I came up here to be with y'all, and they stayed back at the office, so that's okay. The other thing that I basically came here tonight, and I think most of you will notice we have a few additional folks in attendance tonight that we don't usually have with these type meetings. For a long time, Rutherford County school system has had a very stable, very good partnership with our bus contractors. Our bus contractors, over the years, it's gotten kind of convoluted whether they're actually employees or individual contractors. My 14 years I've been with the school system, a lot of times when we are discussing, are we able to give the teachers an increase or the classified staff an increase, the bus drivers always came up. Can we give them an increase? And I think that's something the county commission and the school board as well has done, because they have looked at them as employees. Technically, they are not. They are contractors. 2 years ago, when Mr. Spurlock asked me to begin to oversee the transportation department, one of the things that I noticed first was we had to I read the contract and I realized it was expiring in 2 years. And I thought that's a pretty big undertaking, especially for somebody at that time that didn't know a lot about buses other than I had an uncle that sold them for a while. So one of the first things our new transportation director and I did was begin to gather information on counties in our state, counties outside our state. What do people do? What do their contracts look like? Are they like us, all in multiple independent contractors? Are they sole source like the city of Murfreesboro? They have a bus barn. They have people that do their maintenance. They own their own buses. They own their own equipment. What does that look like, and what do these contracts look like? What's in those contracts? And the first thing we began to notice is our contract that we had been approved over a number of years, and there had not been any changes to it. 12 or 14 years of nothing changed. And I'm not, a lot of that, the board had changed policies on, what can a child bring on a bus. Various things, but our contract did not align with our policies and procedures. So the first thing we did was set apart. We got with Sarah Page, our county attorney, and we began to look at our policies and to craft new policies and procedures for how we wanted the contract to be going forward. Because our policies and our procedures and our contract needs to align. It just has to. So we spent about a year working on that. Then we got with the bus contractors. We asked them to try and organize as best they could. I recommended they hire an attorney to negotiate for them. I may get the number wrong. Somewhere between 70 and 75% of our contractors got together and they formed a committee. And they had elected a negotiating committee to meet with us. There was six. I had Jeff Reed, Sarah Page, myself, Jason Everett, Director of Transportation, and Steve Luker, Principal at Oakland High School. And the reason I picked Mr. Luker is because he's been at all three schools. He's been in elementary, a middle, and a high. So I felt like that was a good broad brush to have. So anyway, we went back and forth numerous times. One of the things that I've had the hardest time getting people to get out of is the fact that they are our partners, they're not our employees. They are contractors. And we need to begin to look at it that way. It's a business. We are in business with all of these 288 contractors. And we need to look at it that way. And part of the thing that came up during the year, our bus drivers' age demographic is climbing rapidly. And a lot of the folks that have drove buses here for many, many years don't have children interested in busing, and they're beginning to retire and get out. Some of our contractors are interested in picking up a few, but there are some, we'll call them tough routes to sell. We ended up with 7 of those routes last year. No mechanism based on our former contract to go outside and get another contractor per se. We have a mechanism to award our existing contracts to our existing contractors. It's a 3-step process. Phase 1, Phase 2, and Phase 3. Most routes at the end of that have been taken by someone, but they're due to the situation we were in and COVID and the location of these routes, nobody picked up these routes. And based on our original contract, we had no mechanism that allowed us to go hire someone from outside, because the way the contract was structured, we were limited by our current pool. And if nobody took it, we couldn't do anything by contract. So that was one of the things that I said, we can't get in this position. Our job is to provide, as long as the school board and the county commission agrees to it, to provide safe and responsible transportation for students to school every day. And that's what our contractors do. They're very good at it. But when we get 7 routes with no coverage, and I have no mechanism, or the school system has no mechanism to go outside and get someone, that's not good for us. We have to be in a position that should, as we go through the life cycle of this contract, we end up with this situation again, we can go outside and hire someone. And that was one of the things that I really wanted to look at. And when I got to looking at the contracts from around, I got contracts from Huntsville City Schools, Hamilton County, Montgomery County, Knox County, Shelby, Davidson County. We got contracts from a lot of our counties and states around us. And I even called some large bus contract that do school buses. And I said, I'm sure you guys have a boilerplate contract. Can you send me one? So I read more contracts about busing than I care to admit. But one common thing kept coming up that we didn't have in our contract. And it's tough, and that's why I wanted to bring this contract to y'all through the full county commission, because this has never been done before. You asked for a few things, and transparency is one of them. And this is something that's never been done. These contracts are typically just done. They go through the process and we go forward. But I'm trying to make this an industry standard contract, bus industry standard. It treats our contractors fairly, puts the school system and the county in a better position that if something happens and I can't get a route filled, I now have a mechanism to go do it. And I'm keeping us out of a lawsuit because I don't need 2 or 3 different contracts out there. Everybody needs to be, we have one contract, you sign it or you don't. The hiccup to this, and it's not really a hiccup, it's just a new way of doing business. Standard in all bus contract, service contracts is a guaranteed cost of business adjustment. And it's 3%. Every contract I looked at is 3%. And it's a guarantee in this contract that they get 3% increase each year. Now, this is a 4-year contract. It's a whole lot less than what they ask for. And I realize a guaranteed contract is a new concept. However, if I get in a position or the school system gets in a position next year with no route coverage and I have to go hire somebody from outside, they will only sign a contract that has a guaranteed escalator. Yes, sir.
What did you do about those 7 routes?
I went to the school board and we did something that we've never done before, and it created turmoil. I went to the school board and asked for authorization to pay, and I hate to use this term, but it's a trucking term, deadhead miles. Our contract stipulates that the bus contractor's route starts when they pick up their first child, and it ends when they deliver their last child to the school. So if they run 2 routes or 3 routes, that their mileage continues. It doesn't start at their home or where they park their bus. Right. So they drive from their home or wherever it is they've stored their bus to pick up that first child. I don't want to use the term free, but they don't get paid for it. So what we had to do, because I had no mechanism, was to go get authorization from the school board to pay those miles for one of our existing contractors to take it. That was the only way they'd take it. So I went out, but I got school board approval to go outside the contract because that was the only option we had at that time. Prior to doing that, in the meantime, that it took us a month or 6 weeks to get to that point, to get all that taken care of, I had buses running double routes. They would run one route and then they'd go run the other. Or some routes were close enough that it would take longer time, but they would pick up all the children. They had capacity on their bus to run both routes at once.
That just, to me, is an interesting thing because I can see from a legal standpoint, the county is obligated to provide the transportation. And which comes first, the obligation to the child or to the bus drivers? And that could be an interesting court case. Very interesting, in fact, whose rights prevail. And I've read through your contract. It looks good to me. And
so I did want to come before this body tonight and for it to go on through our normal mechanism, because this is a change. It's something we haven't done in the past, but what this allows us to do, it puts us in a position that should we, and I hope we don't, But should we in the next year, I end up back in this same boat, I could go outside and get a third party to come in and they will sign this contract. Now, some school systems it's more than 3%, but based on what I saw, 3 was on the lower side of fair. And I don't know if that's how you get to the lower side of fair, but I felt it was fair. And after much deliberation, I think the bus contractors are willing to sign the contract as well. Yes, sir, Mr. Blair.
If you had an issue of being underfunded, has there been a mechanism in some of the contracts you looked at?
You would have to do an amendment. In most contracts, it does not. Now, something we did not have in our contract, as you also are aware, we didn't have anything in the event of a pandemic or a long-term shutdown. We do have language in there for that now. It's somewhat less. Bus drivers get 92% of their normal paid wage. And basically, national average, 8% of a bus contractor's contracts their fuel. So I thought that was fair. They still have employees, and they still have, a lot of our contractors are single bus contractors, and that is their, it becomes difficult when you start trying to negotiate one of these, especially with people you know.
Commissioner Key?
Thank you, Madam Chairman. So the undesirable routes are determined by mileage?
No, sir, it was where their location was.
One more thing, and there's 7 now. Will there be more as schools increase?
Those 7 are taken care of this year. I believe that when we redo our routes this year, they'll be taken care of. There could be some. It's hard to predict. 7, this year was an unusual year. 7 is higher than normal. At any given time, it's not unusual to have a route uncovered. And when I say uncovered, nobody has a contract. If a bus driver has let's say their bus breaks down, it's in the contract that they're responsible for getting another bus and still running their route. If they can't do that, they get one of their buddies to run their route. They come up with their own plan to cover their route. It is unusual to have 7. Most of these came from drivers that either retired and they were on the wrong end of the county, for lack of a better term. And it's just that nobody lived on, they were Laverne routes. So most of our drivers live up this way. And the ones that were down that way, they weren't interested in adding another route to their, they either have 2 buses or 3 and that's all they want. So is it possible? Yes. Do I think I see more of it coming? In the next 3 to 5 years, I would say so, as our bus drivers age. And as they do age, if they don't stay with it. And another problem the bus drivers are having is finding drivers. That they can't get, you've got drivers contractors that have 6, 7, 8 routes. The wife does, and the husband has 6 or 8 routes. They were also beating our system. We had a limit on how many routes a bus contractor could have. And my philosophy is, if I've got a contractor that her and her husband have 12 routes, but according to our contract, they have 6 apiece because they got different companies. If they can run 12, why do I not want to do business with them? They could probably run 14 or 16 routes. So there's my encourage them, take that cap off the limit on it and allow our contractors to expand beyond what they are. If they can do 12, they can probably do 14 or 16, and I know these people, or know most of them.
And this contract is for 4 years right now.
Yes, sir, that's what I'm recommending, yes, sir.
So I would assume, based on what you've learned from the previous 2 years of study, that you'll continue to study this every 2 years or so, so that we don't get in the same position.
Yes, sir. As long as Mr. Spurlock and the school board keeps me. My wife says I'm working another 12 years, so I plan on being around a while.
Well, I guess if she says that, then that's what you're working, right?
Commissioner Blair?
I would like to commend the contractors in my tenure I was always amazed at the teamwork that they took to, if a bus broke down, they would gather on their own, basically, and make sure the children got to school. So there was always that camaraderie to make sure the children were served, even if it might be inconvenient for them for their particular route getting back home late. But the volunteerism that they always had in helping each other, I always found very admirable.
Some of these routes apparently have been around for quite some time. Yesterday on my way into public safety, I was on 1 Mile Lane, and I was right behind bus 40. I rode bus 40. Not the same bus, but...
no, they have a limit on how long they can run them now.
I rode bus 40, and I know who drove it, and so apparently some of these, and bus 40 went down 1 Mile Lane and many other back roads in that neck of the woods, some, well, let's say more than 50 years ago.
Any other questions before Mr. Spurlock takes over?
Hey, if I could just make a comment or two. I've got the old contract pulled up, and it's 60 some odd pages. This one's 35 pages or roundabout, so it's about half that size, and I'm really impressed with that. I'm impressed with all of the work that you guys done, and my only concern about this is this committee committing to financials for 4 years when we don't know what the next 4 years as far as the revenue coming into the county is going to look like. But the contract itself is, to me, very, very, very good, and I applaud not only your work, but also the contractors as they've kind of gone through this process too, realizing that our county has changed quite a bit. I'm not sure how old that old contract is, but my math looks like it's about 16 years. You said 14 years, so it's
close. It's somewhere between 14 and 16, and it hasn't been changed, I don't think, hardly at all.
Very good. I just wanted to commend you. Good job for that. I'm well prepared to make a motion to approve the contract. The only holdup that I have would be the financials.
And the only thing I can say is we go forward knowing what we know now, and that if we have a problem in 2 years, then we have to do some type of emergency amendment to it. I don't know. I don't have that answer. I wish I did.
Thank you.
And then just before we take a motion, I want to clarify, Trey, what you're asking for here is for us to approve this type of a model in terms of the contract. The actual numbers are going to come through on the school board budget when we look at that in May. We'll see the actual specific numbers and the impact that'll have.
Yes,
okay.
That is correct.
So we're not asked to approve the
no, sir,
financials of the process.
No, we're asking for the rate increase, and Mr. Beaudry will have that 5% that we're showing this first year included in his budget line item, and you will see that at that time. I just wanted you to see the contract, the principle of the contract, and that part's what I was looking for approval on. Yes, sir.
Any other questions for Trey or for Mr. Spurlock? Okay. Okay. Very good. Oh. They're talking amongst themselves.
All right.
Yeah. Mr. Spurlock, you want to read the motion?
Yeah, we got a motion to approve the bus contract as presented.
Very good. I'll entertain a motion.
Move to approve.
Very good. Thank you.
Under the language of that, it is included in the proposal, the 5% increase and the 3% increase for every year thereafter. Is that really part of that process? Are we approving that? I just heard that we were not.
We're approving that model, that we're agreeing that there will be an escalator, and that is in the contract on your iPad. There's the 35-page iPad, and that is built into that, yes. So my point to Trey is that we're not approving money outside of the school board budget. That was my point, is that we're going to see these actual dollars in the school board budget.
Once again, we're approving the contract and not the financials at this time. We'll take a look at those when the budget process is in
We'll see the
effect.
specific numbers of the impact of this decision, yes.
Very good, thank you.
Got a motion in a second? Okay.
Commissioner Gammon,
Yes.
Commissioner Key,
Yes.
Commissioner Blair,
Yes.
Commissioner Cook,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes, thank you. Very good. All right. That's the last thing I had on our agenda. Is there any other business for this committee?
Madam Chairman, I would like to commend the mayor with the talent that Ms. Dixon has brought to this county, and with the situation with COVID and losing our health director, and making sure that this young professional talent did not get away to another entity or county. And I would just like to say thank you, Mayor, for stepping forward and getting our legislative delegation involved. And great job. We kept a valuable team member here because of your efforts. So thank you, Mayor.
Completely agree. That's great. Very good. All right. If there's no other business, we stand adjourned. Thank you.